Hello, in this video we will understand about the pathogenic mechanism of group A Streptococcus. For short is gas. So remember, throughout the video we will understand through gas for short. Strep pyogenes, also known as the group A Streptococcus, is known as gas and cause mild human infection such as pharyngitis and impetigo and serious infections such as necrotization of skin and fasciitis. Fasciitis means the fascia will be damaged, and streptococcus shock syndrome will also in the case of severe. Let's begin to understand the strep throat inside of the oral cavity. So this is the normal mild in tonsillitis and severe tonsillitis. The tonsillitis can possible due to the strep throat. So in this way, the normal and abnormal, the severe tonsillitis will lead to swollen tonsil, while the uvula are present here, and this is the soft palate and the pharynx, and the normal tonsil is occur during the mild tonsillitis, while the severe tonsillitis here is the swollen tonsil in the peak. So a whitish spot will be occur in this manner, and this is the pharyngitis can occur inside the into the pharynx. This is the microscopic view of the strep, the gas. This gram-positive cocci that cause a range of diseases. Let's further discuss about another diseases. So remember, it can cause also the otitis. Otitis means the ear disease, the eustachian tube in the middle ear, which that will be damaged. This is the laryngitis can occur also. This laryngitis means the larynx will affect and swollen due to the here is the laryngitis due to the inflamed vocal cord. This is for short review and the diagram to understand. Let's begin to understand this is the digestive system gut. The bacteria remain extracellular space like cerebrospinal fluid and extracellular fluid, etc. When it will be enter into the oral cavity and it will be affect the strep throat as a strep throat, while also in fact when going to the blood circulatory system, this super antigen toxin which that will lead to cellulitis and impetigo. This also lead to cause the strep throat, and this is the super antigen toxin, which that will lead to streptococcal toxin shock syndrome will lead to occur. Cellulites also occur in the hand. In this pic, you can understand as well. So the complication we will discuss first. So the acute rheumatic fever. Acute rheumatic fever due to autoimmune response, which that will lead to narrowed mitral valve causing heart murmur, arrhythmia, and marginatum, non-itchy rash, painful joints, and fever can be 38.2 to 38.8 degrees Celsius rather than the 37 degrees Celsius in our body normal temperature. Due to autoimmune response will lead to cause fever. The rheumatic fever will lead to joint pain, swelling, and fever. The chorea, skin and subcutaneous changes, edema will lead to heart failure and sepsis also. So this is the cellulitis impetigo. Anyhow, next we will learn about the pathophysiology, short review to understand, and next we will understand the treatment of the pathogenicity of this. So this is the microscopic structure which that is containing a cocci. This is the protein F and the lipoic acid. Both are lipoic acid and protein F help to adherence to host cell and successfully colonization where they are present. Gas also produces chemical called streptolysis and hyaluronidase enzyme, which function to destroy host tissue, thereby allowing gas to spread through the host. Protection against host immune system can also possible. But remember that things basically the protection can inhibit how the M protein in particular. Here is the structure is capsule, which that is also inhibit the immune response, while on the other hand the M protein in particular is thought to cause much of the virulence of gas as its function to inhibit the phagocytosis by macrophage. Also protein G, M, C59 and peptidase, C59 peptidase, as well as the protein M, which that is protection against host immune system. So that is why this is the function of this, and that is why the pathogenesis will be trigger and process and progress. Treatment of pathogenicity is antibiotic treatment like the penicillin, ampicillin, amoxicillin, cephalosporin. These are the oral antibiotic first during the mild tonsillitis we can provide. And in this way, if the treatment will not recover and the cure will not occur, in this way the further step will be taken. Antibiotics can be provided for orally, but the 10 days in pharyngitis, normally 5 to 7 days cellulitis, and for more severe toxic syndrome, intravenous antibiotics provided. It is the short review for understanding just. I am not going to understand with detail, so this is the short review of the pathogenic mechanism of group A Streptococcus gas. Let's look at the innate immune response, macrophage. When touch the macrophage invade this is to form an endosome formation. An endosome, the slow and SLS basically combine together will lead to form a endosome formation, and the ubiquitin and the galactin 8 which that will surround it to each other to form a autophagosome. Lysosome is here, and this is basically the NADAs negative, and the presence of NADAs will lead to prolonged survival, while the NADAs when not present the autolysosome will lead to efficient killing. So this is the innate immune response. So remember we have covered the pathogenic mechanism of group A Streptococcus, the treatment, pathophysiology, innate immune response and complication, as well as